think poses the most danger to our lives? Is it a car accident? Is it sharks or lions or bears? Is it spending too much time in the library studying for exams? Well, the culprit is something we deal with every day. Have you ever gotten a swollen and itchy mosquito bite? That's called inflammation. While a bug bite or an inflamed paper cut isn't necessarily always dangerous, chronic inflammation is a different story. The World Health Organization ranks inflammatory chronic diseases as the greatest threat to human health. In fact, over 50% of all deaths in the world are contributed to chronic inflammation. It plays a key role in cardiovascular disease, dementia, stroke, and, as you will hear, cancer. An example of chronic inflammatory disease is inflammatory bowel disease, or IBD. So, what is inflammatory bowel disease? Inflammatory bowel disease is a chronic condition that causes ongoing inflammation in the digestive tract. The two main forms of IBD are Crohn's disease and ulcerative colitis, which affect different parts of the digestive system but lead to similar inflammatory issues. Individuals with IBD often endure symptoms such as abdominal pain, persistent diarrhea, fatigue, and weight loss. The condition primarily targets the colon and small intestine, affecting millions worldwide. Beyond the daily challenges, IBD also raises the risk of developing certain cancers. This leads us to think, how exactly does IBD raise cancer risk? The answer lies in a key concept in cancer biology known as tumor-supporting inflammation. In individuals with IBD, chronic inflammation acts as a major driver for several types of cancer. As one pivotal study explains, chronic inflammation in patients with inflammatory bowel disease leads to an increased risk of colorectal cancer, small bowel cancer, intestinal lymphoma, and cholangiocarcinoma. So, how does inflammation support tumor growth? Deep in the epithelial cells of the colon, inflammation creates an environment where tumor cells can thrive. Inflammatory cells release reactive oxygen species, which have been shown to contribute to DNA breakdown, further increasing the chances of cancer. Inflammation also triggers increased cell turnover, meaning cells divide more rapidly to replace damaged ones, which heightens the risk of genetic mutations. The influential paper, The Hallmarks of Cancer, describes inflammation as fuel for the fire in cancer development. When the immune system becomes overactive, it creates an environment that fosters tumor growth and spread and allows tumors to resist certain treatments. This chronic inflammatory state fuels cancer progression by supplying growth signals, promoting tissue remodeling, and even aiding in the suppression of anti-tumor immune responses. What can be done to help individuals with IBD manage their increased cancer risks? Fortunately, a range of strategies is available to lower inflammation and reduce the likelihood of related health complications, including cancer. Doctors often prescribe anti-inflammatory medications, with 5-aminosalicylic acid being a common first-line treatment. This medication helps reduce gut inflammation and can support remission. Examples of 5-aminosalicylic acid drugs include valsalazide, mesalamine, olsalazine, and sulfasalazine, which can be taken as pills or suppositories. In addition to 5-aminosalicylic acid, other treatments such as corticosteroids, biological therapies, and immunosuppressants like azathioprine or 6-mercaptopurine may be used to control inflammation and minimize adverse effects. Lifestyle adjustments can also complement medical treatments. Increasing intake of omega-3 fatty acids found in fish like salmon, mackerel, herring, and sardines may have an anti-inflammatory effect. Patients might benefit from eating smaller, more frequent meals to reduce digestive strain. Together, these approaches help alleviate symptoms, improve quality of life, and lower cancer risks by addressing chronic inflammation. However, there's a complex trade-off to consider. These medications can increase the chances of existing cancer relapsing, creating a difficult decision for healthcare providers. Dr. Viviana Laredo, MD, has explored this dynamic throughout her career, studying and treating IBD at the Department of Gastroenterology, Lozano Blesa University Hospital. This challenge underscores the delicate balance that must be struck when managing IBD. While medications can effectively control inflammation and improve quality of life, they also carry potential risks, especially when it comes to cancer recurrence. The immunosuppressive nature of drugs like corticosteroids, biologics, and azathioprine can weaken the immune system, which plays a crucial role in identifying and eliminating cancerous cells. Dr. Viviana Laredo explains how by suppressing immune function, these treatments may reduce the body's ability to detect and destroy abnormal cells, potentially allowing cancer to relapse or progress. Additionally, some disease-modifying therapies can stimulate growth factors that support tumor growth, further complicating the situation. Finding the right treatment plan becomes a crucial collaborative effort between doctors and patients, requiring careful consideration of both the benefits and potential drawbacks. This process highlights the importance of personalized care, as each patient's unique circumstances must guide the decision-making process to ensure the best possible outcome. Here, expert insights make all the difference. Dr. Viviana Laredo's 2023 paper, Risk of Cancer in Patients with Inflammatory Bowel Diseases and Keys for Patient Management, Dr. Viviana Laredo's research emphasizes the importance of tailoring treatments for patients with both IBD and cancer. Her findings are shaping new approaches to help healthcare providers make the best decisions for their patients' unique needs. So there you have it, a look at how IBD impacts cancer risk, why inflammation plays a role, and what's being done to protect patients. Researchers like Dr. Laredo continue to offer hope for safer, more effective treatments.